Welcome viewers to the Personal Injury Law Show. This is a show that goes behind the scenes and it talks about everything to do with personal injury law, cases, legislation and anything of interest. Now, my name's Tony Carbone, personal injury lawyer of over 25 years experience. With me tonight I've got Nuncio Tartaglia, a young partner in the law firm that specialises in personal injuries.
Tony, Alice, good evening. Viewers, good evening.
And I've got Alice O'Kane, an up-and-coming star in the field of personal injuries.
Good evening, Tony.
Now, viewers, tonight we're going to be dealing with plastic surgery, that is the debate between plastic surgeons and cosmetic surgeons.
Before we get to that, Tony, what's in the news?
Well, what's in the news is this story that appeared in the Herald Sun that a person went in to have liposuction and what appeared to be a simple procedure turned out to be an absolute nightmare because the person had her bowel perforated. Now, what's that entail?
Tony, this sort of a thing causes a lot of complications for patients. It just means quite a lot of the time you need to have an operation to have either perforation repaired or you do need to have a part of your bowel cut out to deal with it, and you can suffer from ongoing infection or problems internally as a result, and it can be a very long, drawn-out and very painful process.
And Nuncio, what's your take on this?
Look, I think it reiterates the dangers of surgery and that, look, you think you're going for a procedure that you'll come out of it fine, but anything can happen. So you just got to be really mindful of these things, and this is a terrible experience. So.
But can I just say this? The perforation of a bowel, it can actually lead to death because the organ, it can cause problems with the organs.
That's right.
Well, in this particular case, I think the week before, a man or a woman died from being on the operating table. I think having liposuction. So it's very dangerous.
Okay. Anyway, look, we've got to keep moving. During the week, we went to the clinic of an eminent plastic and reconstructive surgeon by the name of Dr. Alan Callis. He was good enough, viewers, to take us into his rooms, show us his operating theatre, and I'm just going to take you to a video of some of the questions we asked him. So let's have a look at that. Dr. Callis, can you tell us a little bit about yourself, your family and training?
Well, Tony, like you, I was the son of immigrant parents, and then I was a young doctor working in Melbourne. My interest in plastic surgery really was stimulated in those early years working in accident and emergency departments when I used to enjoy reconstructing faces and hands which had been damaged by trauma. And so then I went on to study plastic surgery. It's about a 6-year training period, and I spent several of those years in the United Kingdom. The basic qualification for a surgeon in Australia is to be a fellow of the Royal Australasian College of Surgeons. So all surgeons will have that basic qualification. Most plastic surgeons in Australia are members of the Australian Society of Plastic Surgeons, and also many are members of the Australasian Society of Aesthetic Plastic Surgery.
Dr. Callis, can you tell us the difference between plastic and cosmetic surgery?
Well, plastic surgery is a specialty which is recognised by the medical boards in Australia and by Medicare. It's like neurosurgery, orthopaedic surgery, urology, for example. Whereas cosmetic surgery is not really a recognised specialty. So that means that anyone can call themselves a cosmetic surgeon. So any doctor in Australia who does what he considers to be surgery to change appearance can call himself a cosmetic surgeon. Whereas to call yourself a plastic surgeon, you have to pass all the requisite exams and become registered as a specialist in Australia.
Dr. Callis, what are the reasons why people have plastic surgery?
The reason patients choose to have aesthetic surgery is not, as is widely believed, because of vanity. A vain person is a person who seeks attention, who wants to be noticed, who wants to be beautiful. Overwhelmingly, the main reason that people ask for aesthetic surgery is because they want to look normal.
Doctor, what are the types of operations you perform?
Perhaps we should just go into the operating theatre so I can show you where these surgeries are actually performed.
Sounds like a good idea, Doc. What do you think of that, Nuns?
That was interesting viewing, Tony. He said it was great. I think it's great for the show and great for the viewers that they can go into and have, I suppose, a real close look at what happens in those plastic surgery rooms.
Alice,
fantastic.
It was great that the doctor allowed us into his sterile environment.
That's right. No, it's good of him to let us know what really goes on inside, and it's helpful as a member of the public to know what it's all about, what it's like inside there, and what you might expect when you go there for an operation.
Look, the viewers, the key to the discussion tonight is there's a raging debate between the plastic and reconstructive surgeons and the cosmetic surgeons. Now, there is a difference because, well, maybe you can tell me what the difference is, Nance. What's the difference between the plastic surgeons and the cosmetic surgeons?
Well, basically, plastic surgeons are qualified surgeons and they're fellows of the Royal Australian College of Surgeons. Is that right?
They're fellows of the Royal Australian College of Surgeons.
So they're qualified. They've had, I think it's 12 years of experience, which combines of 7 years in that particular specialty of plastic surgery. So they're as qualified as they come. Whereas cosmetic surgeons, there's no specific qualification. They don't have to do any specific training, and really, you know, GPs can be sort of, you know, can do cosmetic surgery. So it's a really wide gap.
And what's your take on the difference, Alice?
Well, it seems, Tony, that generally speaking, plastic and reconstructive surgeons are not only a fellow of the Australasian College of Surgeons, but also they are a member of Society of Plastic and Reconstructive Surgeons, whereas cosmetic surgeons seems to be a much broader sort of group of people. And as Nunzio says, GPs with a specific diploma can perform some forms of cosmetic surgery in their rooms, which can be problematic.
Well, can I just say this? On that case that we were talking about before, that was in the news, there's been an enormous amount of liposuction cases in the last 5 years. And the interestingly, the Australian College of Cosmetic Surgery decided to throw their little bit into the equation, because they say the college is the only organisation that offers liposuction diploma course, including examination and annual recertification. The college maintains procedure-specific register for liposuction, which requires a minimum of 100 cases experience before a doctor can be included. That's what Dr. Zachariah from the Cosmetic Surgery Association said. Does that mean they're more qualified than the plastics dealing with liposuction, Alice?
Look, Tony, I think that that's a really interesting question, because the cosmetic surgeons would definitely tell you, yes, we are more qualified than your average plastic and reconstructive surgeon, but your average plastic and reconstructive surgeon would say 100% of the time, I've had more practical experience on the table doing these things. So there's a lot of tension between the two groups as a result.
And I think that's why the Australian College of Cosmetic Surgeons, they want to make cosmetic surgery a specialty, a formalised specialty like plastics, orthopaedics, and make sure that they're recognised in that area. So, look, it's going to be a debate that goes on for a long time.
Nunzio, they would be saying that a lot of the plastic surgeons go to their courses because they're specific to certain operations. So they're saying that they're more expert than the actual surgeons that have had all their training and, say, 12 years of it.
Look, it's a bit akin to, like we were talking about before, like a lawyer. Like, you know, we're specialists in personal injury law, but are we specialists in contract law? Even though we're lawyers and we're qualified to do it, what can we do?
That's exactly right.
Guys, we've got to go to a sponsors break, so viewers, please stay tuned, because after the break, we're going to come back with more of Mr. Callis, Dr. Callis that is, at his clinic, and he's going to take us into his operating room. Thank you.